Okay, so this is kind of last minute, and I didn't want to leave it to the last minute just because there's a lot of information that's important that I think needs to be said. But I made the decision to get my implants taken out, removed properly. And I came to that decision after a couple of years of having a lot of physical ailments that many specialists and doctors were not able to figure out what was causing my symptoms. And it's caused a lot of emotional stress. Many times I've felt like maybe everything I've been feeling really isn't there. Maybe it's in my head. It's been really discouraging having lots of blood drawn, scans, x-rays, procedures, basically everything that you can think of done to try and figure out what's going on, and nobody's been able to exactly pinpoint. I've seen cardiologists, I've seen I can't even get into every single doctor that I've seen for my issues, but at one point I was placed on like 15 different medications, everything having to do from anxiety medication, beta blockers for my heart, medication, anti-seizure medication, and I wasn't even experiencing seizures. Just so much, and I finally got so frustrated with everything, having to take pill after pill, and nobody giving me answers, and so I finally got just really depressed about everything and decided to just try and put a positive mindset, say, well, if I don't think about it, maybe it'll go away, or maybe it won't be bad enough to where I think that I need to get somebody to look at it and look further. So that lasted maybe a couple of months. This past year, probably around February, I started having extremely horrible sharp pains in my chest. Tenderness, I couldn't even wear a bra. It hurt to wear a bra, it hurt not to wear a bra. To try and sleep, that was just not happening. I basically went days without getting hardly any sleep at all. I couldn't get into any comfortable position. So I finally made the decision to call my OBGYN. And I was like, maybe it's hormonal, maybe it has to do with, my cycle, the hormone changes, estrogen, progesterone, all of that. Except I had a hysterectomy probably 8 years ago now. And my ovaries were left in, but everything was taken out. And so not having an actual period on a monthly basis, it's really hard for me to try and gauge, what would have been my normal cycles, to try and tie in, okay, maybe this truly is hormone related, maybe it's an imbalance, deficiency, whatever the case. It's just really hard for me to try and make a determination because I don't have that monthly cycle to go by. So I figured it would be best just to go see my gynecologist and maybe they can give me some answers. So they got me in right away. I just told them everything I was experiencing, and I got in, and I was seen, and in the physical exam, they basically told me that they had a lot of concern for how tender in the area was. They really hardly were even able to palpate the area to try and see if they could feel anything because I was in so much pain. And so they said, you know, rather than us basically blindly push on something that maybe we shouldn't be pushing on, we want to send you to have a mammogram and ultrasound done. So I agreed, and at this point, this would be the second mammogram and ultrasound that I would have done in 2014 on a just regular routine, my annual checkup with my gynecologist. They found a little nodule lump area. It didn't hurt. I didn't even know it was there. She found it and said, you know, I just want to have this looked at. You're over 30. Let's go ahead and get a mammogram and ultrasound done. So that was in 2014. I went to the facility to have that done. And so they just noted that, yes, they saw it, but it wasn't anything to be of concern. It basically just looked like a lot of fibrous tissue, some kind of like fibroid cyst, basically nothing to even try and biopsy or anything like that. So nothing was ever done with that. So fast forward to February, so they sent me to go have a mammogram and ultrasound done, and I had the worst experience with the lady who did my ultrasound. Like I can't even begin to describe the horrible, like I wouldn't even call it bedside manners, like lack of that she had. She made me feel like this big, basically like I was wasting everybody's time for being there. She said that she wasn't seeing anything and that everything looked normal to her, and that basically the radiologist would read her report and then send it to my doctor, and then I could get dressed and go home. So by this point, after doctor after doctor, scan after scan, blood work, tests, everything, that basically was my last straw. And I truly felt like, okay, this is not in my head. Like, this pain is so intense now that I can't even sleep, I can't wear a bra, I can't function, I can't do anything, I'm in pain, and I hate taking any kind of medicine if I don't have to. And so trying to even get this pain to a level of where it was manageable, I knew that I would have to end up taking a lot of pain medicine, and I was not about that. So I went home. I was really upset. I talked with my family about it. I just knew something wasn't right. I knew something wasn't right in me, and I knew that something needed to be looked at further. Somebody needed to take the time to actually try and figure out what was wrong with me, and I felt like nobody's done it this far, so I have to do it for myself. So the next day I went, and I went back to the facility where I had my scans done, and I requested a copy of my medical records. And because it's law, they have to give that to me. I was able to get everything from the written radiologist's report to the actual images, and because it was the same place I went to back in 2014, I was actually able to view what those images look like 2 years ago versus now. When I went home and I put the CD in my laptop and pulled everything up, I was amazed and upset, and I had so many emotions going on. I really can't even tell you exactly what was going on in my mind. what stood out to me were the images of my left breast, my implant from 2 years ago versus today was, first of all, without even having a trained eye to read images, it was so blatantly obvious that my implant had shifted position. It wasn't even sitting in its pocket, and it was extremely deflated. So much so that actually the shell of my implant was creased. It actually was like crinkled in the image, and it had a lot of white tissue-ish looking stuff like all around it. And then even on my right side, you could tell that like the implant had somewhat deflated, but it was nowhere extreme like the left side. And the left side is actually the side that was causing me so much of my pain at that point. Like, it was the most tender. And so things just started adding up to me after seeing this, and I was like, it's my implants that are causing my problem. So I immediately went to the written report, and I wanted to see, okay, what did the radiologists have to say about this? And I was absolutely disgusted. It happened to be the same radiologist who read my report 2 years prior, and he he stated that he even made note that he compared the images 2 years prior to the current images and stated that the implant seemed to be intact and no change, and that there was no abnormalities, and basically everything was fine. So I was livid. I was upset. I came unglued. Because of his report, because of what I was seeing, and then knowing that if I didn't take the time to be my own advocate and go back to this facility and request to get my medical records and actually see for myself and then do my own investigation, this would not even have been caught, because the report would have gone straight from their facility to my doctor's office saying everything was fine, everything looked intact, and they probably would have referred me to, I have no idea, I don't even know like what kind of specialist, but they probably would have referred me to somebody else, because they would have been like, well, we've done as much as we can in our scope of practice, so we'll have to just refer you back to your PCP, and then you'll have to go from there. So I was just so upset and happy because I did the investigation and I found this information, but I was kind of like, okay, what do I do now? Like, where do I go? So first thing was I went to my OBGYN and I showed him everything, and I said, listen, it was because of this lack of care from the ultrasonographer that caused me to go back and request my records. But I'm glad I had that experience, because had I not, I wouldn't have gone back and got my records. I wouldn't have found this, and it just would have been it still would have been a huge mystery for everybody. So they were really concerned about that. They were not happy. Actually, I didn't even know this, but my physician, he is the president of the company or the facility that I had all those images done at, and so he was not happy, and he made a lot of phone calls. Let's just leave it at that. So he told me that the best thing for me at this point would be to contact my surgeon who did my initial procedure of my breast augmentation, and follow up with him, and then see what kind of plan of care we could come up with. So I did. That was ridiculous. It was like almost a joke. I had the appointment. My mom actually went with me. My husband wasn't able to make the appointment with me, so my mom went with me. And it's a good thing I did, because I don't think a lot of people would even have believed what happened if I didn't have a witness there. So the surgeon comes in, and he pretty much like cuts me off in the middle of me trying to explain all the physical ailments I've had, all the mental fogging and cloudiness, and just crazy symptoms that nobody's been able to determine what's the cause, and pretty much bypasses everything that I'm trying to explain and build to create the picture of why I'm there that day, and says, okay, well, let's just go ahead and get your physical exam out of the way. So he's like feeling around, and he's like, well, I wouldn't really say that it's ruptured, but, you know, it's obviously causing you a lot of pain, so I'm just going to go ahead and remove your implants for you free of charge in my office under local anesthetic. And immediately my mom and I looked at each other and were like, what? Like, that is no. That, first off, like, I'm sure anybody else would have jumped on the opportunity of being like, whoa, free, I don't have to pay for anything. Like, that's awesome, that's a blessing in disguise. No, that's like a red flag. Like, why are you so anxious to get this out? He was more anxious to get this out of me than I was, and I'm the one that's in pain. And why would you do it under local anesthetic? So then when I started questioning him, and I was like, okay, well, I've done some research on this, and I've learned that after you have an implant placed in your body, and this is for anybody, your body sees it as a foreign object, which it is, and so it attacks it and creates this capsule around it, which is basically like scar tissue. And it kind of like, it just basically surrounds the implant wherever it's sitting in its pocket. And the longer you have it in your body, obviously the longer your body has to build that capsule and scar tissue around the area, just due to normal wear and tear and just irritation inside your body's cavity. I went under my muscle, so from what I've researched, I know, or I've learned that when women have their implants that are above their muscle, it actually causes for worse capsular contracture, and that's when the capsule that's being built, the scar tissue that's being built around your implant, will actually start to contract down on your implant, which can create like really hard looking boobs and actual hardness, and also just deformities and like all kinds of stuff. Like, it's crazy. So I knew at that point, like, if I choose to take my implants out without replacement, I need to take out the capsule also. Like, that's scar tissue. It's not meant to be in there. It can cause a lot of health issues if you leave that in your body, for like infection and fluid buildup and all kinds of stuff. So when I asked him, when he was like, yeah, I'll do it free in my office, local anesthetic, like in and out type procedure, I was like, okay, well, what are you gonna also remove my capsule? And he was like, no, there's no need for that. And knowing everything that I had researched, and I had like, oh my goodness, I could have probably created a book with everything that I've looked at for resources and made sure that they were reputable and all of that. And so I was like, no, this is not sitting well with me. And my mom was not happy either. And so we chose to just not do anything with him. So after more research, I was able to find a physician that's not far from where I live. Actually, she's world and like everybody around the world knows her because she's been on Discovery Channel. People have flown from Australia, from all over the place to come and see her. She actually specializes in implant removal or explant and capsulectomy, which is removing the capsule, which is the way that it should be done. So her name is Dr. Susan Kolb. She's in Atlanta, and she's with a company or a group called Plasticos. And I scheduled an appointment with her to have the procedure done. Yesterday I went and had all kinds of labs drawn, ultrasound done. I got to meet with her, and she did a complete workup on me, physical, mental. She checked for possibility of mold buildup in my system, because what she sees a lot of that happens with people who have saline, which I have saline, I don't have silicone, I have saline. When they have a rupture, where that's filled when they're placed in your body is from a valve, and a majority of the time the leaking comes from the actual valve. It could be due to trauma, blunt force trauma, mammogram, whatever. And so what can happen is you can start to build, bacteria can grow in there, mold can grow in there, and just cause a lot of systemic issues for the person, and they would never even know. So this is actually a real problem, and there's a thing called breast implant illness, and I just really want to promote for anybody who's out there that has a lot of medical problems that are not being diagnosed, and not, you're just going from doctor to doctor. And really do your research, get out there, be your own advocate, request your medical records, look at what they're looking at, because a lot of the times people overlook things that not necessarily they do it on purpose, but they're human and it can happen. And if you don't take your own health into your own hands, nobody's going to see it as important as you would for yourself. So I just really, my goal in this whole process is to promote self-awareness. Be aware of what's going on in your body. Be aware of changes, pain, anything that just makes you feel like something's just not right. There's usually something not right. Like, there's usually a cause for what's going on. I'm gonna document my experience as I go through it. I have my pre-op tomorrow, and then the next day I have my surgery, and I'm feeling really anxious, nervous. I'm not replacing my implants, so they're taking everything out, and I'm really nervous about how my body will look afterwards. Definitely health-wise. I mean, this is why I'm doing it. I want to be healthy, and I don't want to deal with this anymore, but I would be lying if I said that my image isn't kind of playing a factor into my nerves and anxiety and everything. But I have a really amazing husband who loves me and supports me and is reassuring of, he wants me healthy as well. He wants me to not hurt anymore and be sick all the time and lethargic and just not myself. I mean, I haven't been myself healthy-wise for a couple of years now. And so this will just be better for everybody involved. I will be sure to keep you updated on everything that's going on. Again, tomorrow is my pre-op day. I get my results from my labs and all of that, and then I will have my surgery the next day. So I'm hoping, I don't know how I will be after surgery. They told me that it could take up to 4 hours which is a really long time. That also has me really nervous. But as soon as I'm able to and feeling up to it, I will definitely make another video. And if you have any questions, I'm not claiming to be an expert, but I will do the best that I can to try and answer to the best of my ability. And if I can't, then I will definitely point you in a direction that hopefully gets any questions answered. Yeah, any advice or anything like that, if you've gone through this before, definitely let me know if I should expect anything. I just would appreciate feedback. So thanks for taking the time to watch this, and I will see you later.